number of videos on psychiatric illness and also on substance abuse in the hopes of developing a library of videos that one could look into and hopefully discover what, if anything, is wrong with him. This first video is of special note to me because I promised the patient that I would do this video first regarding his issues. His wife was actually a patient of mine for a couple of years, and she started telling me about her husband, who was pretty disabled psychiatrically, emotionally, and he had been in one of our foreign wars and finally left the military after a few years, and had suffered quite a bit of trauma, although he didn't lose any limbs or whatnot. But for the next 12 years after he got out of the military, he attended a local VA hospital. And as often happens, we hear stories of veterans being on an increasingly number of medications. And his wife said that every month they've got a bag of pills from the VA that was bigger than a gallon of milk and would not even fit in their mailbox. So I encouraged her to have him come in and see me, and he eventually did. He was diagnosed with PTSD and about half a dozen other things, most of which were not accurate. And I re-diagnosed him with a different disorder, bipolar disorder. I think he may have had a couple sleep disorders, social phobia. So to make a long story short, he ended up on 2 medications. One was lithium for his mood disorder, and the other was Suboxone for treatment of an opiate addiction. I don't know that he was addicted before he went to the VA, but if he hadn't been, he was. He did become addicted during his treatment. He now functions pretty much normally, although he's, I don't think, capable of going back to work, but he's no longer as depressed. He's much more capable socially, and he is very pleased with the outcome of his problems. So there are lots and lots of misdiagnosed people in society because they've been given an incorrect diagnosis. So I promised him I would highlight his case in the hopes that maybe other veterans would think about getting evaluated again by someone else.